Welcome to the Introduction to Mistletoe in Small Animal Veterinary Medicine. Whenever we start a class, when we deal with something from anthroposophic medicine like mistletoe, we start the class with a poem. A poem means that you get introspective. You are going now to keep your attention in a subject. And when we study a poem, this makes you to go to your right brain, and this makes you more sensitive for the information you are going to receive. So let's go for it. Inner quiet. Quiet I bear within me. I bear within myself forces to make me strong. Now will I be imbued with their glowing warmth. Now will I fill myself with my own will's resolve. And I will feel the quiet pouring through all my being, when by my steadfast striving I become strong, to find within myself the source of strength, the strength of the inner quiet. Rudolf Steiner. This is me, Claudia Costa. I graduated in veterinary school in 1991. I got a master's degree in veterinary clinic in 2005, and I practiced homeopathy for over 29 years. I got a specialization in iridology, training in traditional Chinese medicine and acupuncture, training in anthroposophy, training in Hei 1 and 2 and Mahikari art. I studied multi-species systemic constellation, and I have a post-graduation in integrative oncology with human doctors. I published 2 books, Veterinary Iridology, Vertebrates, that is still in Portuguese, and Mistletoe in Small Animal Veterinary Medicine. That is the first book for veterinarians really studying mistletoe to treat cancer of our pets. So I work with mistletoe since 2008. And what is mistletoe? Mistletoe is the most studied and used plant in integrative oncology. More than 65% of oncology patients in Germany use it concomitantly with different treatments. And there is a vast scientific literature. More than 1,500 articles in PubMed, more than 3,600 articles in the web, all them about basic science and clinical studies. So it's a very well studied and known plant used to treat cancer, most known in Europe, Central Europe, but is still very well studied. There are many books. One of them I would suggest is Mistletoe, the genus Viscum. This is a really important book, and there you can find many informations that you are going to find out in this lecture. What is mistletoe? The scientific name for mistletoe is Viscum album L, L from Linnaeus. It belongs to the angiosperm and belongs to the Viscaceae family. The common names are mistletoe, European mistletoe, European white-berry mistletoe, common mistletoe, all hill, muslin, muérdago in Spanish, der Mistel in German, and Visco album for Latin people like me that I come from Brazil. The habitat for mistletoe is partially parasitic. It grows on several arboreal hosts. It grows on the top of many different plants. The main uses of mistletoe are for festive decorations, and medical use. Known risks: leaves, stems, and berries can be poisonous if ingested, so take care with tinctures, they can be very poisonous. And there is the conservation status, low level of concern. And if you go to the south of Europe, you are going to find out that we have many plants that have mistletoe in their top. Mistletoe grows on deciduous trees native to Europe, Asia, and North America. The genus name Viscum refers to the stickiness of the plant due to the viscous juice in the fruits that help the plant to stick to the trees. So in this picture you can see the deciduous tree that hosts mistletoe plant. And this is very interesting. This mistletoe has this round form, and it grows from the center to the periphery, all in this round formation. The species name album means white in reference to the white fruits, the white berries. Mistletoes are hemiparasitic plants, which are commonly evergreen. In the middle of the worst winter, when everything is covered by snow, mistletoe keeps green, very alive. They will obtain water, nutrients, and minerals from their host plants. They are considered hemiparasitic because they can produce their own food via photosynthesis during at least some point in their lifetime, although most of the time it gets all the nutrients they need from the host plant. What about mistletoe history? Mistletoe is considered since the Druids a sacred plant. The Druids from the Celtic culture used to celebrate the beginning of the winter by collecting mistletoe and hanging it in their homes. It was associated with fertility and longevity. Mistletoe was famous also for the legendary golden branch that saved Aeneas from the world of criminals in Virgil's poem in Greece. And in the Viking mythology, mistletoe is famous for the story of Baldur, the god of light. The goddess Frigg, Baldur's mother, asked all things on earth not to harm her son. But, unfortunately, she forgot about mistletoe because mistletoe was on the top of the plant. Loki, the god of deception, discovered this weakness and made a spear of mistletoe, which was used to kill Baldur, resulting in great sadness among all the gods. This story, this myth, illustrates the importance of mistletoe as a symbol of life and death in Norse mythology. So, mistletoe has a very beautiful history. And we continue on. It was said that in battles, when enemies met on the battlefield beneath mistletoe, they should lay down their weapons and forget their difference for a day. And in the tradition of kissing under the mistletoe during Christmas is very pagan. It was understood that people should kiss under the mistletoe to remember love instead of hate. One fruit, each berry must be removed with each kiss. So we have a long history for mistletoe, as I told you, since the Celtic culture. But last century, Anthroposophy found out that mistletoe could help patients suffering from cancer. In ancient times, mistletoe was used to treat epilepsy, splenic enlargements, arteriosclerosis, hypertension, and rheumatic disorders. Hippocrates, Paracelsus, and Hahnemann studied mistletoe. They described the benefits of treating patients with mistletoe. But Rudolf Steiner, the father of anthroposophy, was the first to recommend the use of mistletoe for the management of tumors. In 1916, the preparation of mistletoe begins according to recommendations of Steiner and Dr. Ita Wegman. This very beautiful lady here was the first doctor, human doctor, a woman that opened an integrative clinic treating cancer and many other diseases, but in the view of the anthroposophy. In 1917 was the first mistletoe application in an oncological case by Dr. Ita Wegman and under the orientations of Steiner. Anthroposophic medicine developed by Rudolf Steiner together with Dr. Ita Wegman is not intended to be an alternative to medicine based on natural sciences, but an extension of knowledge and therapeutic means. Anthroposophical medicine is known as a scientific but spiritual science. We can study mistletoe under anthroposophic perspective, and even talking about tumors, it's very, very interesting. The first thing mistletoe does is the cosmic and earthly forces. Accordingly to Rudolf Steiner, cancer arises from a disharmony between the formative forces, astral and etheric bodies, and the physical body. When there is a disharmony between all these formative forces, you have the disease. Mistletoe, a semi-parasitic plant that does not root in earth, it never roots in earth, but grows on the top of the trees, represents a balance between cosmic and earthly forces. It joins the cosmic on the top and the earth on the bottom and deals with the body. It represents this balance and helps to realign the patient's vital energies. A second point that is very important is the inverse growth principle. Unlike normal plants that grow toward the sun and follow seasonal rhythms, mistletoe goes in a contradictory way. It flowers in winter, has no direct contact with the soil, and follows its own autonomous rhythm. It reflects the unregulated, chaotic growth of tumors, and by introducing mistletoe extracts, the body receives a counteracting force to regulate this unbalanced proliferation. So, when cancer comes, it's like something is autonomous. It's an unregulated, a chaotic growth of the tumors. It starts spreading. Mistletoe comes as a counteracting force to bring back all the body to its normal way of functioning. A third instance is rhythmic system restoration. In anthroposophic medicine, health is seen as a harmony between the nerve sense system, the thinking, rhythmic system, the feeling, and metabolic limb system, the willing. We divide the whole body in three parts. The nerve sense system that is catabolic where high level of awareness, wakefulness, and information roots. It's on the top, on the head mainly. The rhythmic system causes balance, alternation, emotional layer of awareness and dream. It's on the leaves of the plant. It's in the chest mainly. You can think about lung and heart. And the metabolic limbs system that deals with the metabolic production, allowing an action low and all the time it's metabolic in the belly and the members, and it's linked to the sleep. So all these properties are in the flowers of mistletoe. Cancer is linked to the overdominance of the nervous system, leading to uncontrolled cell division. Remember, we have this happening in the head. And then mistletoe, though its structure yet independent growth, is thought to restore the balance between all these three systems. We say mistletoe comes from the fire and it gives all the organization to the whole body, giving the right place to the nerve sense system, the rhythmic system, and the metabolic limb system. Fourth, healing and through warmth and life forces. Mistletoe preparations stimulate the etheric body, the water, the emotions, the life force that governs regeneration and vitality. Cancer is viewed as a condition where the etheric body has lost control over cellular growth. The etheric body that controls emotion and all we feel loses control over the cellular growth. Mistletoe's warming and structuring qualities reignite the etheric forces, supporting self-healing, supporting life. And for the fifth, we have spiritual and individual aspects. Anthroposophy sees illness not just a physical disorder, but as an opportunity for soul development. Mistletoe therapy is often accompanied by artistic therapies, eurythmy, movement therapy, and inner work to support the patient's holistic transformation. Of course, all this data comes from human beings, but we can never forget that all our pets lives with us in our familiar system. So I always say, it's not the animal that is the only one who is ill. We have to look for all the human system, familiar system. Everybody is linked all together. And when we treat with mistletoe, all this familiar system comes to something that was first or before getting ill, organized body. Thus, mistletoe in anthroposophic medicine is not just a physical remedy for a spiritual and cosmic force that helps reestablish harmony within the individual and in our specific situation, our pets, we can deal with the familiar group altogether. What about mistletoe extracts? There are many different ways of using mistletoe. We have homeopathy, we have injectables, we have tinctures, we have many ways of using mistletoe. But what we have to see is that Rudolf Steiner and Dr. Ita Wegman developed a real oriented way of preparing the fresh extract of total plant obtained from white mistletoe Viscum album L. The manufacturing involves different special techniques. You can use this in a fresh extract or you can use fermented. But the one that I'm going to talk here is about Elixir, a German extract from the Elixir laboratory in the very south of Germany. And this fresh extract is prepared always paying attention to Dr. Ita Wegman and Rudolf Steiner orientation. So, apart from sodium chloride to make the formulation isotonic and sodium hydroxide to adjust the pH, there are no additives, no preservatives. It's just fresh extract of the total plant. The amount of fresh plant used to produce an ampoule of aqueous extract is expressed in milligrams. 100 milligrams of fresh plant is used to produce a 100 milligrams ampoule. The main mistletoe components are the mistletoe lectin, glycoproteins, and the winter extracts have more lectins than the others. Viscotoxins A13, 1PS, UOS are polypeptides, and we can find more viscotoxins in the summer extracts. We have other peptides, polysaccharides like arabinogalactone and galacturonan, and some oligosaccharides. We have more components, but these are the most studied and most important ones. It's important to say that the best way to use mistletoe is to use the whole plant. And when we prepare mistletoe, according to Dr. Rudolf Stein and Dr. Ita Wegman, it's important to say that the plant must be collected in 4 different times in the whole year. And we have the whole plant, berries, leaves, branches, all together to make this fresh extract. So let's talk about the main indications for mistletoe. We can use for prophylactic treatment, and we use mistletoe in defined precancerous lesions. Our objective is the involution of precancerous lesions. So when we have a disease that we know it can turn on into a cancer disease, for example, if we have chronic bowel disease in cats and we know that it can grow and turns into intestinal lymphomas, this is a prophylactic treatment using mistletoe to prevent the development of cancer in these animals. We have the additive treatment in active cancers. We can use mistletoe concomitantly with oncological treatment. So if you are using chemotherapy, radiotherapy, immune therapy to treat cancer, you can add mistletoe to this treatment. So you are going to have immune protection. You are going to increase tolerance to chemotherapy and radiotherapy and immune therapy too. If you want adjuvant treatment post-remission, so you diagnose the animal with cancer, you make a good surgery, so you want to prevent of post-surgical recurrence, or you treat with all this chemotherapy, radiotherapy, and so on, and you want to avoid oncological remission, so you use mistletoe in order to have immune stimulation and increase the time of survival. And unfortunately, we know we have some patients that have inoperable cancer and metastasis. For these ones, we have a palliative treatment. The goal here is to improve quality of life and reduce the rate of cancer growth. So it's very important to tell your client what is your objective, your goal when you add MISTLETOE to your oncology therapy. It's important so you are not going to have a frustrated client. This client must know that for each situation we deal with MISTLETOE in a different way. It's different when you are working with a prophylactic treatment. It's different from a palliative treatment. But in all these cases, you can have benefits for adding MISTLETOE to your treatment. You can do MISTLETOE alone. There are many clients that don't want all the chemotherapy, radiotherapy, and so on. Or there are many clients that try chemotherapy and these pets can't bear the situations, they can't bear the treatments. So in many aspects, MISTLETOE is a real good option. So when you use MISTLETOE for treating solid tumors, you can treat concomitant with systemic malignant disease like lymphomas, multiple myelomas, and leukemias. And you can use for prevention, recurrence after primary curative therapy, as we mentioned, and you can prevent precancerous lesions like chronic hepatitis B that leads to a liver cancer in human beings, ulcerative colitis, intestinal polyps, chronic inflammatory bowel disease, and many other situations. Other indications for MISTLETOE are bone marrow stimulation for primary disease of bone marrow, induced myelosuppression treatments, autoimmune diseases, recurrent infections, chronic joint inflammatory process. Studies are showing that including diabetes and liver diseases have some benefits from using MISTLETOE. So there are many different situations that MISTLETOE is very interesting in treating cancer and inflammatory diseases. MISTLETOE mechanisms of action. You can use MISTLETOE for stimulation of self-healing factors in cancer patients by stimulating the inflammatory immunological process. This is the most important. You can have local inflammatory reaction at the injection site. You increase body temperature. It's very important to remember that patients with cancer have lower temperature. What happens is that if a patient suffers from cancer, if you keep measuring the temperature, you will find out that these patients have lower temperatures. The average is always lower. And this makes this metabolism of this cancer patient working in a very low speed. So when you use MISTLETOE, you increase the body temperature, and this makes the animal and the person, whatever the patient, to improve this. We call this warmth body. It increases leukocyte count, neutrophils, eosinophils, lymphocytes, and we increase peritumoral inflammatory reaction, calling all these leukocytes to the point of the reaction. So, as clinical effects, we find improvement in general condition, so we improve disposition, appetite, interaction, sleep alertness cycles, and biological cycles. We improve the tolerance to chemo, radiotherapy, and immune therapy. We improve the survival time. We improve the stimulation of the bone marrow. We decrease the tumor pain, and we decrease the tumor growth rate. The immune effects of MISO2 are activation of immune cells, macrophages, granulocytes, lymphocytes. We increase body temperature, we increase the inflammation at the application site, informing that this body needs help. We increase the number of leukocytes, the number of NK activity. We increase phagocytosis and the liberation of endorphins. So, as highlights, we have a specific cytotoxic action on neoplastic cells. It induces apoptosis and necrosis and inhibits angiogenesis. There is positive immunomodulator for patients with compromised immunity. It tends to balance Th1 and Th2 responses. It stimulates the attack of cytotoxic T and NK lymphocytes on tumor tissue. It goes direct to the site of the tumor. Non-neoplastic cell DNA protector. It avoids damage caused by chemo and radiotherapy. And MISO2 rebalances the neuroendocrine system, as I told you, releasing beta endorphins, generating a feeling of well-being, reorganizing this patient. There is no evidence of important drug interactions. It can be associated with any therapy in integrative and or conventional medicine. You can use MISO2 with homeopathy, with German medicine, with Chinese medicine, with whatever you want. MISO2 goes well with vitamin C, goes well with ozone therapy. Don't apply when the patient has fever. This is the only situation we have to pay attention unless it's tumor fever. There are some tumors that causes fever. In this case, it's okay to use MISO2. But if you have fever, you have to pay attention. Stop MISO2 and try to find out if you have a concomitant illnesses. Treat these illnesses and then you come back to MISO2. That's the only situation you have really to pay attention. It's very safe. We have many studies on studying safety of MISO2, and even in people and children and animals, it's very, very safe to use MISO2. No important reactions. We have many different types of MISO2. In the whole Europe, we have many different laboratories. You can have MISO2 for many different plants. Since we are talking about Helixor, MISO2 done by this laboratory, Helixor have mainly 3 MISO2 types, and they differ in qualitative and quantitative difference in composition. And we have difference in inflammatory stimulation and protective effect. In each plant that MISO2 parasites, we have different compositions, different kinds of lectins and viscotoxins, and it's very important to know these 3 different kinds of MISO2 so you can choose the best MISO2 for each cancer situation. We have MISO2M, Mali, from the apple tree, MISO2A, Abietis, the fir tree, and MISO2P, Pini, from the pine tree. MISO2A, the Abietis, the fir tree, are indicated for neoplasms in the head, including metastasis and neck region, for CNS neoplasms, thyroid carcinomas, paraproteinemias like multiple myeloma, and prostate tumors. Whenever you don't want a big reaction, you choose MISO2A. MISO2A suits for animals that are very weak. Sometimes you receive patients that can't bear a full reaction. So we start the treatment with mistletoe A. That is the mildest mistletoe in this tree type, between these three types. Mistletoe M from Mali, the apple tree, are very well tolerated by animals with good physical and general conditions. So if you have a patient that's very weak, you start your treatment with mistletoe A. But if you have an animal in better physical condition that has urogenital neoplasms, gynecological and breast neoplasms of the digestive system, including liver and pancreas, and immune-stimulating action and tumor inhibition with more intense inflammatory reaction causing heat and fever. So this kind of mistletoe is stronger than mistletoe A and is very interesting for neoplasms that are located in the abdomen. It's important to see that it has a more feminine energy, although you can use mistletoe either for female or male patients. But this is a plant that has more feminine characteristics. And we have mistletoe P from pine tree, neoplasms of the lymphatic system, like lymphomas, thymomas, types of leukemias, some types. For cutaneous neoplasms like melanomas, basotheliomas, squamous cell carcinomas, mast cell tumors, histiostomas, and plasmastomas goes very, very well with mistletoe B. Neoplasms of the respiratory system, breast neoplasms too, neoplasms of the male reproductive system except prostate. If you want to treat prostate, you should use mistletoe A. We don't want a big inflammation in the prostate. It could cause pain. Like we don't want to have inflammation in the brain. That's why we use mistletoe A in these situations. Mistletoe P is important for kidney neoplasms, sarcomas, carcinomas with multiple or diffuse metastases, and for a strong immune stimulation. It's important to remember that mistletoe P is for animals in very good conditions. This is very important. You cannot start your treatment with P if this animal is weak. It can have any kind of these tumors that I have talked about P, but if the animal is suffering a lot, choose mistletoe A first, make this improvement, and then you go for mistletoe P. Okay, it's very important to have this in mind. You can use mistletoe in different routes of administration, such as subcutaneous injections. This is the most common way of using mistletoe. Intravenous infusions that are very interesting for cases that you need more quantity of mistletoe and your approach is more aggressive in the treatment, or the animal needs more mistletoe that a subcutaneous injection can provide. You can use intralesional or intratumoral. If you have pancreas or internal organs and you want to apply to inject mistletoe, you have to use ultrasound guided, and you can use peritumoral. In my experience, I do prefer peritumoral than intralesional injections. You are going to have less reaction and the results are better. You can use intraperitoneal when you have, for instance, a carcinomatosis, when you have metastasis of the peritoneum. You can use intravesical for bladder cancers, and you can use intrapleural in cases of pleural effusion of tumor cells. You can perform pleurodesis and then application of Viscum album directly into the intrapleural space. So you can choose many different ways of using mistletoe, and for each situations you are going to use a different type of mistletoe, a different route of administration to improve your results. And that's why it's very important to study how to use mistletoe first using subcutaneous injections. Then you can choose other ways of using it depending on the case you have. This is a brief summary just to make it easier for you. So if you have Helixor A or Viscum album A, you can use for central nervous system tumors, head and neck tumors, leukemias, or situations like FeLV and FIP, autoimmune diseases, hypersensitivities, chemotherapy, radiotherapy, immune therapies. And remember, you can always use Elixir A, Viscum album A, when you have very weak patients. It improves the quality of life. It improves the situation of this patient. As soon as this patient gets better, you can go for Elixir M or P. So Elixir A is a tool, always when you need to start a treatment and you are not sure about which mistletoe you are going to choose, your patient is very weak. As soon as it gets better, you can choose a different kind of mistletoe. You can use mistletoe M for breasts, cancer, ovaries, uterus, digestive system, stomach, biliary tumors, intestines, pancreas, spleen. Any kind of tumors that are in the abdomen can be used. You can use Elixir M. And pay attention, you need a general good condition of this patient to bear the fever and other reactions that are not very important. But if the animal is not okay, please choose first Elixir A, then go to M, and then go to P. And P is very interesting because it's the one that has more lectins and viscotoxins. The effect on apoptosis and necrosis of the cancer tissue is stronger. So you can use Helixor P, Viscum album P for skin, for lungs, for hematological cancers, lymphomas, spleen tumors, kidneys, digestive system, breasts, and sarcomas in general. Remember, we need good condition of these patients. I brought this case to show to you how MISO2 can help our cancer patients. This female, she was a mixed breed born in 2012. In December 2020, she had an increased abdominal volume and prostration. She went to a vet. The vet performed a CT scan and they found out that this dog needed splenectomy because of spleen tumor. In the histopathology test, they found out that it was a splenic hemangiosarcoma, a very aggressive one. After the second chemotherapy in January 2023, she had vomits and diarrhea. The owner said no to chemotherapy. She said she wouldn't continue the treatment, and she tried to find out someone that could deal with the cancer in a different way. She found me in March after 2 months, and this dog was still under prostration, apathetic, and inappetent. Her weight was 17.3 kilos and her body temperature 100.22 degrees Fahrenheit degrees. I requested staging by using some lab tests and x-rays. There were no metastases, and I prescribed integrative therapies and Helixor M 1 milligram 3 times a week. It's important to say she was thin, she was prostrated, and she looked old. She started MISTLETOE 1 milligram in March, and in May she had no reactions. She went for MISTLETOE M 5 milligrams. We always increase the doses. 3 times a week. She was feeling better. Her body temperature improved, and she put on weight 1 kilo. 1 month later, she was still in good conditions, and we went to Helixor P 10 milligrams 3 times a week with no response, no fever, nothing. 5 days after going to P 10 milligrams, she had a next morning prostration. We used to inject the MISTLETOE in the evenings. So in the morning, next morning, she was at 39.5 centigrades, and she was a little bit prostrated. This is good. This is fever. Finally, we find out reaction. So we kept Helixor P 10 milligrams 3 times a week. And look, she put in weight more. She was 2 kilos heavier. Next year, in April, she was really good condition. She weighed 22.5 kilograms, and she kept having next morning fevers. Her Helixor P 20 milligrams 3 times a week. In August, we increased the dose for Helixor P 30 milligrams 2 times a week for 3 months. She was so okay, no metastasis, nothing. So at this time, it was almost 1 year and 6 months later. She had no fever, no prostration. She was really okay. Next year, 2 years after, she had no Helixor since January 2023 here, and she came just for periodic examinations. In October, I saw her again, and she was really okay. So what I can say is that this animal had wonderful benefits from MISTLETOE. Hemangiosarcoma is one of the most aggressive tumors we have, and we know by literature that they can live 3 to 6 months. This animal had no metastasis, and she lived a long time. I followed her for 2 years with no recurrence of the disease. What I can say, as far as I can say, this is due to MISTLETOE. It's amazing. This slide is very interesting. I want just to show you how MISTLETOE works and how, when we think about integrative veterinary medicine, we can help our patients. All these actions can be found when we treat cancer. The first thing we want to see is the tumor control. We try to find stabilization, improved survival, and a relapse prevention. I think this is the goal most doctors want to find out. But we can alleviate symptoms and complaints. For instance, using MISTLETOE, we can diminish pain and fatigue. We can handle conventional cancer treatments, and using MISTLETOE, you increase tolerability, decision-making, acceptance, successful conduction. We see that these patients accept the treatment and receive the drugs with fewer problems. Another thing is that we have in advanced disease achieving a good condition despite the tumor progression. We have some patients that we cannot stop cancer, but although this tumor is very aggressive, we can cope with the disease and we can keep a good condition till death. Another thing is achieving responsiveness and agility. These patients are more alive. We have strengthening physical, emotional, mental health, immune system, and healthy capacities. When we use MISTLETOE, all this is achieved. We improve recovery, for instance, sleep, appetite, and restructuring is always seen when we start a treatment with MISTLETOE. We can overcome crises because we learn to cope with fever, and this is very important. We overcome functional limitation and social constraints. Sometimes we have animals with bladder, urine problems. We have situations with diarrheas, vomits, and MISTLETOE can help and to overcome these situations, and these animals feel better and cause less problems to the owner. We never give up our patients. This is important. And MISTLETOE gives autonomy to the patient from the disease. When the patient can get acceptance, peace, perspective, less bother, it accepts the disease from medical experts. You can receive the situation and you can accept the situation. This is something that we find in people with cancer and what we see in our familiar group that deals with a cancer patient animal and use MISTLETOE. All the system has this autonomy, and all the existential issues through emotional and cognitive development, coping, depression, positivity, courage, personal goals and interests, spiritual aspects, everything, all those existential issues improve. And here, in this both points, we are talking about the familiar system. So you can live with the disease, you can overcome the disease, you can find an own way to live with disease, and you can reframe a situation. Cancer can be a turning point for a familiar system. Although sometimes this animal can die, all the familiar system can learn from this situation. I always say the disease is something that brings knowledge and consciousness for the familiar system. So in a way, although it's difficult to say, it's a bless when you really receive the gift of a disease that can be treated with MISTLETOE. And finishing our class, we finish with a poem again from Rudolf Steiner. From head to toe, I am the image of God. From heart to hands, I feel the breath of God. If I speak with my mouth, I follow God's will. When I see God in all things, in my father and in my mother, in all my loved ones, in the animal and in the flower, the tree and the stone, I fear nothing, only love for everything around me. Rudolf Steiner. If you are interested in MISTLETOE and learn how to use MISTLETOE for your cancer patients, you can buy my book. You can have the book through the WhatsApp plus 5511 948 109000, or you can go to www.reginalzonevet.com. In the site from Dr. Jill Rubin's Whole Zone Vet, you can find my book. You can buy there. This is the first book for veterinarians, and I can tell you it's very complete. It will help you to treat your cancer patients. And, of course, if you are in this lecture, you're about to have a training in MISTLETOE. Be welcome, and I'll be very happy to have you there. Thank you very much. And you can find me in my WhatsApp, in my Gmail, my email, ciavet.claudia, gmail.com, my Instagram pages, and YouTube as well. And I have my website, www.theintegrativevet.com. I hope I can find you there. Thank you very much.